So when you were saying that you've done a lot of studies with young children, what does emotional regulation look like in kids versus adults?
That's a great question. Depends what age range you're looking at.
Okay.
So if you're looking at infants, because they're so little, they don't actually have much practice with their emotions and definitely less practice with what they do with their emotions. So a lot of younger infants and toddlers, they actually look to others for comfort. And it's similar to what adults do as well. So when you're sad or angry, some people like to turn to friends, family, partners. So with young children, often the most common thing we see is them turning to their parent or a grandparent, even a sibling, for comfort. Or they might tug on their parents' dress and say, like, please help me, I can't do this. Or they might cry or whine, and that's to elicit support and comfort. Whereas if we look at 4 to 5-year-olds, as they get older, they become more independent. So they've learned, I can manage my own negative emotions. So some kids might decide to go into their room if their parents have, initiated timeout. And this is for them to kind of self-soothe. Yeah. We also see kids suppressing their emotions as well. There's a really cool study that started, in like 1990s by a researcher called Sarni. And it was called a disappointing gift task. So in this research, they asked children, hey, look at all these fun toys. You're going to get one of these prizes after the study. Which one would you like? And then the researcher actually picked a broken toy to put into a toy box for them at the end. And so after they completed a task, they brought the broken toy in and say, great, thank you so much. Here's your toy. And they found that as young as 3 years old, children know how to pretend and to hide how they're feeling.
Yeah.
So, and this gets better as they grow up. So they get better at hiding their negative emotion.
That reminds me of, have you seen the video of the little kid who gets like an avocado for Christmas?
No.
It's such a goodie. Like his parents wrap up this avocado and he opens it and it's like the sweetest thing. And he's like, an avocado? Thanks. And I'm so happy about it. It's the cutest thing.
That's so cute.
That situation, he really did like avocados. I don't know. But it was good.
That's adorable.
So then what does emotional regulation look like in romantic relationships?
So in one of our studies, we invited couples to come into the lab. And this is actually quite a standard procedure across the world used to study romantic relationships. So we invited couples into the lab and we set up some cameras to record their interactions. And we asked couples to list down their top 3 significant issues in their relationship. And then we picked one and we say, okay, so your partner has listed this issue for you to discuss. Try to discuss this as you normally would. And then we left the room and we hit record and then we just wanted to see how they interact. Afterwards, we code for their behaviors, like how they communicate. And for me, what I'm particularly interested in is how they regulate or express their emotions. So you'll be surprised at how quickly couples forget that the cameras are there. So we do actually get quite a variation of behaviors and how people express emotions. So what we coded for was emotional suppression. So these were signs that people were trying to hold in their emotions, trying to bite their tongue, or just not express how they feel. And so some of these behavioral indicators were things like crossing their arms and just like sitting back. So you got a sense that they were trying to pull back from the interaction. And sometimes they like actually bit their lip, the typical one. So sometimes when people feel like crying, they look up.
Yes, just the gravity, just forcing the tears back.
Yeah, forcing the tears back, swallowing. So it's quite clear. We also looked at whether people tended to ruminate or they kept circling the problem instead of focusing on finding a solution. So rumination in terms of thinking is when your negative emotions or thoughts are persevering. It just keeps going around in your head and you can't get rid of it.
Yeah.
It manifests similarly in interactions. So people can say things like, oh, we've gone through this problem so many times. You never fix it, or I've told you so many times not to do this, that this hurts me.
Right.
And then the last one is similar to cognitive reappraisal. It's a more positive strategy where people are trying to reassure their partner and focus more on the positive aspects of their relationship, saying, oh, this is something that we've overcome before. I'm sure we can do it again this time. So we coded for those behaviors by watching those videos. And then we also asked them straight after the interaction to report themselves. How much did they try to suppress their emotions during the interaction? How much did they ruminate about the problem? And how much they try to reframe the situation.
And are people self-aware enough to give a good self-assessment?
We don't really know how to tap into that. So this is their own perception, right? And you know yourself best. What we did find, though, is when people who said and were observed to be suppressing their emotions more reported that, we didn't really resolve our problems. And that was the same for rumination. But cognitive reappraisal was better. So if you try to reframe the situation in a positive light, then it led to better outcomes for you and your partner.
Could you give me an example of a helpful thing that someone can say?
Some people focus on the relationship, the strength of the relationship, or they communicate love and care. So they may say something like, "You're always so good at this, though. We've overcome this before. Our relationship is strong. I know we'll get through this." If it's something to do with the problem, is they can sometimes minimize it, but not in the same sense of suppression. So they might say something like, "It's okay. It's not actually such a big deal. I think if we do XYZ, then I think we'll be okay."
Yeah.
So trying to lift the situation a little bit.
Yeah.
Yeah. And there's a lot of focus on problem solving. So instead of focusing on the problem itself, they quickly switch to actual solutions.
Yeah. And does that still provide the space to actually discuss the problem? Because I feel like I can also see the alternate, the opposite, where it's some people are so solution focused that you never actually discuss what was wrong in the first place.
Yeah, that's a really good question. I think it's a fine balance. You need to make your partner feel cared for and that you understand where they're coming from and that their issue is a valid issue before you move on to actually find solutions. Yeah.
So when you talk about emotional regulation as a child and as an infant, and then how that kind of changes when people grow up, how does the way that you've learned to regulate emotions earlier in your life then impact your romantic relationship?
That's a great question. So the way we regulate our emotions is actually stems from our interactions with our caregivers. So depending on how we feel as infants, although it's not very conscious, but it depends on whether we feel that we can turn to our caregivers in times of need. So when we feel distressed or emotional, as young infants, like I said before, we often turn to our close others, like our parents, because we don't know how to self-soothe yet. And so if you have a parent who can serve as a secure base or a safe haven, a safe place where you can return to, so a parent who would respond with warmth and kindness and love, you're going to learn that you can turn to others. And eventually, this gives you the space and also the confidence to learn how to deal with negative emotions yourself. But if you have a parent who minimizes it, so imagine that you're really upset about a toy that you've broken, and your parent either gets angry at you, saying, if they say, "Oh, stop crying, it's just a toy," or if they say, "Oh, it's not a big deal." And so if someone dismisses your emotions, you eventually learn that you can't turn to others for support and you have to do it by yourself.
Yeah.
And that's quite different from the one I said before, where you learn to deal with it by yourself. and knowing that you can still turn to others.
Yeah.
This one, this is usually where we learn to suppress our emotions. So we're like, okay, emotions are bad. Emotions disrupt relationships. So I'm going to try to just not feel them.
Yeah.
We learn a lot about the value of our emotions or whether they're valid from our early experiences.
Yeah.
The other pattern that we see that parents do when their infants or children are sad is they aren't always available. So sometimes they are, sometimes they're not. And this can make children feel quite insecure. And they're worried that their parents might abandon them and not come back or be there for them if they show too much sadness.
Yeah.
Yeah.
So there's that instability.
Yeah, exactly. Instability. So this is what we call attachment styles, but that was a barely scratching the surface.
Yeah.
But your attachment styles when you're an infant predicts your emotion regulation strategies
Okay.
in interactions with your partner.
Yeah.
Yeah.
You can look us up on Instagram, TikTok, Facebook, YouTube, wherever it is that you doom scroll your life away. And if you want to see more of me, you can head to Instagram at Goddess by Night.